I just came back from the Mexican Society of Plastic Surgeons meeting where I spoke about my technique, my 5-suture technique, to create great shape in the deep plane facelift. Let's talk a little bit about it. So of course, a facelift is not just about lifting, it's about creating shape, and shape in particular is best appreciated when we have beautiful contours in the face. What's the contour that we seek? We seek a double ogee curve. An ogee curve is where we have a convexity that meets a concavity. It's an architectural term. Now, how do we apply that to facial surface anatomy? We want to have a little bit of fullness here, amount of convexity in the cheek, then a little bit of a hollowness, then a little bit more fullness, again, once again in the gonial angle region, and then a little bit more of a hollow beneath the mandible. Here's an example of a patient who's really experienced that beautiful transformation. You can really see it on the oblique view. Now, how do I bring about that? I have a 5-suture technique. That 5-suture technique has alternating vectors. In the SMAS, up and then to the side, up once again in the platysma, and to the side once again. That does different things. It creates a little bit more volume, a little hollow, volume, hollow. Now, the SMAS 1 and SMAS 2 sutures are placed in vectors that are different from one another, creating different purposes, different effects. They're anchored to the deep temporal fascia, and that gives strength to that deep plane. There's a specific location that I placed the SMAS 1 and later SMAS 2 that help bring about that fullness, hollow, fullness, hollow. You can see the benefit this patient had elevating the soft tissue was down here, way up onto the cheek, creating a much more youthful appearance. Now, the platysma sutures do two things. One is platysma 1 going mostly vertical. It wraps the tissue around the gonial angle and it gives definition there. Whereas platysma 2 is back and it's pulling soft tissue and looseness out of the cervicomandibular angle break point, creating that definition of the jaw above. I do that first suture in a stair-step fashion to bring the tissues very vertical into that postauricular hollow, crevice, if you will, and then brings it back onto the mastoid. The final suture is the security smoothing suture. Just keeps everything in the deep plane nice and tidy in place, smooth contours that complement the ogee curve that's a double ogee curve. Here's our final example. Look at that gonial angle definition. Beautiful restoration of contours. Very happy patient.